Hey, my name is Shelby Nicholson. I'm a nursing student here at the University of Alabama, and today I'm going to be performing my medication administration checkoff. Alright, so here's my ID. And then I'm going to do a room scan. Okay, so I would make sure that I was in a no interruption zone, meaning all doors closed. I'm not taking any phone calls, and I'm not having any unnecessary conversations with my colleagues. So first I'm going to verify my medication order and my 5 rights. So the 5 rights are the right patient, the right drug, the right dose, right route, and right time. So I'm going to come over here to my patient care order form. I have Jaguar J. Jones. My MAR says Jaguar J. Jones, 8/25/1963, date of birth 8/25/1963. Drug heparin, dose 5,000 units, dose 5,000 units. Route subcutaneous, time every 12 hours, time every 12 hours. I'm also going to verify the allergies, so allergies penicillin and allergies penicillin. Alright, then I'm going to perform hand hygiene, and I'm going to select the right medication. So my MAR says heparin, so I'm going to come to the medication vials, and I'm going to choose heparin. I'm going to make sure that it lines up. Alright, so the expiration date is 12/5/2025, so I know that it has not expired and it is okay to use. Alright, so then I'm going to verify the right time. So it's every 12 hours, and I see on my MAR that this patient has not received heparin in the past 12 hours, so it is time to administer it. Alright, and then I'm going to choose the right route. So it says subcutaneous, so I'm going to be using a 1 milliliter tuberculin syringe and needle. Alright, so I'm going to calculate the dosage. So I have a 1 milliliter syringe, and my MAR calls for 5,000 units, but my vial says 10,000 units per milliliter. So I'm going to draw up half a milliliter in order to achieve my 5,000 units. And I would also have another nurse come out and verify that I calculated the dosage correctly. So I'm going to take my alcohol pad. I'm going to clean the top of the vial. I'm going to take my syringe out. I'm going to take the cap off. And I'm going to draw up 0.5 milliliters in air first. Alright, then I'm going to put it in my vial. I'm going to squeeze the air out, and then I'm going to turn it upside down, and I'm going to draw up a little more than 0.5 in order to get any kind of bubbles out. Then I'm going to thump until all the air bubbles are out. Alright, take it out, pull the safety cap up, and show you 0.5 milliliters of heparin. Alright, so then I'm also going to create a little label to put on the syringe, and it's going to have 3 different things on it. It's going to have the name of the patient, so Jaguar Jones, and it's going to have the name of the medication, so heparin, and it's going to have the dosage, 5,000 units. Alright, so I'm going to take that piece of tape, and I'm going to put it around the syringe. Okay, and then I'm going to go over my 5 rights again. So I have Jaguar J. Jones, date of birth 8/25/1963. I have heparin. I know that I just put heparin in the syringe, and I have 5,000 units. I calculated correctly that I would do half a milliliter. And then subcutaneous, I'm using a tuberculin syringe, and every 12 hours I see that the patient has not received heparin in the past 12 hours. So I'm going to take my MAR and my medication syringe over to the patient's room. Okay, I'm going to perform hand hygiene. I'm going to use my 2 identifiers to make sure that I have the right patient. Jaguar J. Jones. MAR says Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963. So I have my allergy penicillin, allergy penicillin, and then I would ask them about their allergies, and this is when I would also perform any pre-assessment or pre-administration assessments. Like if I was given a blood pressure medication, I would take their blood pressure. Alright, so then I'm going to compare to the MAR to make sure I have all my 5 rights. So I have Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963. I have heparin in my syringe. I calculated my 5,000 units, which is half a milliliter. Subcutaneous, I have my tuberculin syringe in every 12 hours. They have not received heparin in the past 12 hours. All right. So then I'm going to perform hand hygiene. I'm gonna raise the bed up to working height. I'm gonna lower the side rails. I'm going to put my gloves on. And I would also explain the procedure to the patient, so I would tell them that I was giving them a subcutaneous injection into their abdomen. Alright, so I'm just going to put that on. Alright, so I have my syringe. I have my alcohol. Well, I'm going to put my goggles on. Alright, so I have my alcohol pad. And I'm going to well, before I wipe the injection site with my alcohol pad, I'm going to locate my injection site. So I would do it in their abdomen, making sure to stay away 2 inches away from the umbilicus, stay below the costal margin and above the pubic region, and stay in between the anterior superior iliac spine. All right, so then I would assess the site for the skin condition and, you know, if the tissue had anything abnormal. So then I'm gonna clean the site in a circular motion. All right, I'm going to take my syringe and take the safety cap down. Since I am injecting in a subcutaneous manner, I'm gonna pinch the skin. I'm gonna insert at a 90-degree angle. I'm gonna slowly inject it, keeping the skin still pinched. Okay, I'm going to take it out. I'm going to put the safety cap on, immediately put it in the sharps container, apply gentle pressure to make sure, and I would make sure there wasn't any allergic reaction or anything like that. So I'm going to lower the bed to the lowest position, raise 3 out of the 4 side rails up. I'm going to take my gloves off, throw them away, take my goggles off, perform hand hygiene. I would document the administration on my MAR and document patient response if there's any pain or anything like that. Okay, and then I would clean my area off and assist the patient into a comfortable manner, and that's the end of my medication.